On the occasion of World Digestive Health Day, 29th May 2015, we are talking on heartburn, which is the theme of this year. Heartburn is a very common problem in population all over the world and in population in India. Heartburn is a common symptom and everybody at some stage or the other has had an episode or two of heartburn. This is basically burning sensation behind the chest, and this is a common symptom, and several times it is just short-lived, but some people have heartburn for a prolonged period of time or recurrent symptoms for a long time. This is indicative of a disease which we can call medically as gastroesophageal reflux disease or GERD. So these patients, they will have heartburn at least once a day or several times a week. This is usually postprandial, and this is because of the abnormalities in the gastroesophageal region. Normally, gastric acid does not affect the esophagus or affects it for a very short time. But in these patients, gastric acid remains in the esophagus and causes symptoms of heartburn. Most of these are patients, Indian patients of gastroesophageal reflux disease, have what we gastroenterologists say as NERD, non-erosive reflux disease. That means the patient have symptoms. If you do 24-hour pH monitoring, they will have evidence of reflux, but on endoscopy, upper GI endoscopy, you will not get any active lesions like ulcers, erosions or congestion. So these patients have, we are lucky, our patients usually have milder disease, but the minority of patients could have more severe disease in form of ulceration, stricture, Barrett's esophagus, which is a pre-malignant condition. So these patients should be evaluated carefully and treated appropriately. For diagnosis, since 24-hour pH monitoring is not available everywhere, so a 1-week PPI test, proton pump inhibitor test, is if the patient responds, his symptoms resolve with proton pump inhibitors for a week, then he has reflux disease and he can be continued on treatment. Otherwise, at least an upper GI endoscopy should be done to exclude any severe form of reflux disease in which there could be findings of ulceration, erosions, Barrett's esophagus or hiatus hernia. The treatment of reflux disease is mostly with the use of proton pump inhibitors which inhibit gastric acid and so reduce the pH. Modern lifestyle causes or aggravates the propensity to cause the kind of foods we eat, fatty foods. We drink drinks like Pepsi and Coke, which are full of these agents which relax the GE junction. So, and then obesity is a common problem now because of lack of physical exercise, more time spent before the computer or the TV. So obesity is a common problem, and these factors aggravate the propensity to cause reflux disease. So one should have a healthy lifestyle, one should have daily exercise, one should use fatty food in moderation, one should maintain a normal weight as far as possible, and avoid smoking, which also relaxes the G junction. And if all these fail, then of course we have drugs which will resolve this problem, but they have to be taken for a pretty long period of time. So gastroesophageal reflux is an important GI problem which affects a large part of our population. But with lifestyle changes, with careful diagnosis, with appropriate treatment, we can control this illness and prevent suffering to a large section of our population.